Hi, I'm Edwina Arceo. I'm a school administrator and owner. I'm here for my second session of Sculptra, which the first one I had in February. I'm here because CSA is the most reputable, if not one of the most reputable clinics here for different products to improve one's personal appearance. And I'm a fan of Dr. Contessa Salvador, Alapag, because she is well-rounded in this field, and she has gone through, if not weekly sessions of mentorship of other similar doctors in this field, and you couldn't find anybody like her who's been so experienced and well-rounded. As always, I am very appreciative of Dr. Contessa handling me in this second session of Sculptra. Thank you.
Good day, everyone. Welcome to CSA Medical Aesthetics. We are here with Ma'am Edwina Arceo. And like 8 months ago, we've done a first treatment called Sculptra. And also we did therapy. How was it, Ma'am Edwina? Yeah.
So happy.
Right. So we've seen visible results. There was like a reduction of those sagginess, mid-face and lower face. And plus, if you assess the skin quality again, we do a pinching test, you'll notice like an improvement in the firmness and tightness of the skin, because as time passes by, our skin loses that natural elasticity, natural tightness and firmness, because collagen gets depleted, and so you'll notice your skin becomes loose, you'll notice some lines and wrinkles, some sagginess. So we also need a treatment to restore the collagen formation, elastin formation, bring back po those natural fibrous tissue proteins in our skin. So today, we'll be doing a second treatment, a second session of that Sculptra. So we'll again work from the temple, mid-face to lower face. And this time, we'll add on an improvement of the so-called nasolabial fold and marionette line. Na-notice nyo na po, Ma'am Edwina?
Yeah.
The deepening of this nasolabial fold, and plus this so-called marionette line. The others call it puppet line. This one here. And then we wanted to reduce further the jowls here. So we'll be using Sculptra, and we'll add on a so-called Restylane Refyne. We'll show that when we return. Back, so let's do our so-called markings of our injection treatment. So we'll be working on this right side first. So we'll mark from the zygomatic arch here. This one is our entry point for our cannula method of our Sculptra treatment. So since our entry point is at this area, I'll just make this like lines here. It's gonna be like a fanning method. That's what we call fanning. And then we'll still work on the mid-face to treat this Indian line here, or so-called mid-cheek groove. We'll also deliver some products here of our Sculptra. Same as before, Ma'am Edwina, right? We'll just do a single entry point, then we'll also deliver products here towards the angle of the mandible and also towards the preauricular region. There you go. And then later on, I'll be adding a so-called soft filler, a refined filler. So we'll be having an entry point here, and I'll also use a cannula. I'll be using the so-called Refyne, and I'll fill in this sunken part of this nasolabial crease here, and a little bit here on this marionette fold here with an entry point here. Okay, so that's our marking. So it's good that we follow some designs or patterns when we do injection treatments, right, Ma'am Edwina? Okay. And then we'll be using a 1 vial of a Sculptra. Sculptra is made up of polyl-lactic acid, and this is a polymer that is used for restoring tightness and firmness of our skin. It's for full face rejuvenation, Ma'am. So it's indicated for those people with concerns of lines, wrinkles, skin laxity, sagginess, or aging of our skin. And if we want to restore those collagen, elastin, we can do that. So entry point here, I'll just use a gauge 19 needle. So Ma'am Edwina had like topical lidocaine a while ago, for about half an hour and to 45 minutes, and then take it off, and then cleanse the skin, disinfect, and then this is our entry point. I'll make a tiny prick there. Okay, Ma'am Dwayne, sorry po. So I'm using a gauge 22 cannula, and I'll just deliver in the temple region, like a one line there. So this is called a fanning technique there. Another line there. We'll just follow the markings that we did, and another line there. Okay, and one here at the posterior temple, another line there. There you go. So as to the anatomical layer, it's recommended to place it in the subcutaneous part, and I will go here at the anteromedial cheek. Okay, so I'll just pinch the skin like that and glide my cannula and place it in the anteromedial portion, just one line and then a second line. Just follow these markings you've done, and we're placing it in the subdermal plane. You need to place it in the correct layer where your fibroblast cells are, because your fibroblasts will make your new collagen and new elastin and also glycosaminoglycans. So we need all those extracellular matrix proteins plus those proteoglycans to restore skin tightness and firmness. So we're improving the overall skin quality. So we'll deliver here. So inferior already. Okay, now I will go to the posterior aspect. So we're almost finished, Ma'am Dwayne. You're still good. She already had developed some tolerance to these kinds of injections. So as to the experience, most of our patients are sharing with me that it's something tolerable. You feel some pressure, that's normal. Then we're almost. So I'm using a 4.5 ml per side, so just distributing the product. So again, this is a Sculptra 1 vial, then almost nearing the end. Okay, and placing again at the posterior angle mandible of the angle of the mandible. Okay, and then it's required that you do massage after this. So I'll proceed with the Refyne. So I'll be using a gauge 25 cannula here. A while ago we used the so-called gauge 22. Okay. Just glide it. I'll be using the superficial plane layer here. So our injectors are aware of the location of the facial artery. We avoid that. So a tiny amount of our Restylane Refyne. So this one is made up of hyaluronic acid. And hyaluronic is a substance present in our skin, in our tissues, in our body. So it's something natural and something very safe. And we've been using this product for a very long period of time. Okay, just filling in this part here, so it's gonna go up. So a bolus of our product there. Then almost 0.2. And then let me also correct the marionette. So this is now the marionette. So after doing this part, I'll just continue with the left side. Ma'am Dwayne, sorry, this is the last one on this side here. So we can improve the line here. So this is also good for those who have downturned corner of the mouth. So if you want to improve that, we can use this kind of treatment to elevate the corner of the mouth and also prevent the deepening of the so-called puppet line. Okay, so this is hyaluronic. It's something natural. It traps water. It holds water. It's responsible for the skin turgor. So let's proceed to the left side. We have done the procedure for Ma'am Edwina. We had the Sculptra treatment and together with our Restylane Refyne. So let's show the result. So Ma'am Edwina, check lang po. Kamusta? So she had a kind of some lifting already on the mid-face. And I noticed already the mid-cheek groove was reduced. And somehow our nasolabial fold was reduced. So there's already like a certain percentage that it was reduced or improved. And gradually it will still change because your Restylane Refyne will attract water and it will still expand inside and plump the tissues, and more tightening and lifting will happen. Usually the collagen formation on the 3rd month, you will really notice a very good effect from this Sculptra combined with our Restylane Refyne. Message Ma'am Dwin.
I'm very happy.
Wow.
Super, thank you.
Yes.
Very nice.
Thank you so much, Ma'am Dwin, for trusting us also for these kinds of treatment, because these are injectables. Not everybody would want to go into this kind of treatment that you're putting in something inside. And the important thing is we have products that were scientifically studied. They have like evidence-based studies, and the safety is proven. The product's effectiveness and accuracy is also there. And this has been used all over the world, and it has been there for a very long time already. Yeah. And Ma'am Dwin will still travel tomorrow. Because some of my patients, they ask me, I have a flight tomorrow. Is it okay to do the procedure? We have a lot of clients flying in and out of the country, so it's okay. And we've done a treatment that somehow when you fly, you won't have any worries. And we'll just give you advice like what to do after, like for example, ice compress, what not to do as well, what not to eat as well.
Well, what not to eat?
Yeah, we'll give you a list po. Thank you so much, Ma'am Dwin. Have a safe flight.
Thank you.
We'll
Thank
see
you.
you when you get back. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.